Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and also the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And our guest this evening is Julianne Van Loo. Julianne is the director of the Polk County Health Department, and we're going to talk about public health. So welcome.
Thank you so much for having me.
It's so nice to have you here.
Excited to be here.
We met at an event, kind of a public health event, a couple of months ago. We were talking about clean water.
All sorts of cancer-related stuff,
And-
but yes,
oh,
that's
yes,
the hot
right.
topic.
That's right. We were actually talking
With the
about
Iowa Cancer
all
Registry.
of cancer with the Cancer Registry. And so before we talk about public health and what your job is and what it means to be the director of Polk County Public Health, tell us a bit about yourself. Where did you grow up?
Sure. So I grew up here in Des Moines. I'm happy to say I'm living my dream job now of running the local health department in my own backyard. I've held this job in other places, so it's great to be back here. But I left and spent half a decade up in the Twin Cities and then was down in Kansas City, so have done public health around the Midwest, and just came back home a couple of years ago. to
Yeah,
run the
well,
health
it's great to have you back here. Which high school did you go to?
I went to Dowling.
Okay. And how many in your graduating class?
Oh, Lord, do people still know that? Do you guys know that?
I know that, yes.
I'm
yes, I know
impressed.
that.
Like 250-ish?
Okay, yeah, it was pretty big.
Yeah.
I mean, it was a big. So what was
I was sent there to
your
play
personal
basketball and
claim to fame in high school?
Sports.
Sports. Okay, and
Yeah, I had
which
the
sports?
height. Basketball, volleyball, mostly, some
yeah,
softball.
because you're tall. Mm-hmm. And
Happens.
did you have good teams? Did you make it to the state?
Yeah, we had a run at the state for many years, yeah.
Okay. Did you win?
pushing my memory.
A title? Did you win a
I
state
don't know,
title?
this is like a whole lifetime ago.
Oh, you're being.
No, we didn't win a title, but
Okay.
we were quite successful.
Okay,
Yeah.
well,
It was
good.
about time.
And then when you graduated from Dowling, where did you go next?
I hopped around and went to a number of schools. So if you don't find the right one at first, try again.
Okay.
I ended up graduating from Drake,
Okay.
political science and international relations as my focus.
And then when you graduated, did you go to work or did you go on to graduate school right away?
To graduate with my senior thesis for international relations, we had to make the case for what was a primary element that helped a lesser developed country become a greater developed country and move, forward in prosperity. And well, my research ended up showing me that if you invest in girls and women, then you don't only succeed from health and community building and childhood education, actually economically things get much better for that community and that country. And so I got really obsessed with maternal child health and the way if we invest in our moms and our babies and kiddos from an early age, right, the primary prevention principle, then we're going to see a different future than the one we've had. And so kind of entered public health actually through more of the political science policy lens, but was glad to find my way into it. And now I'm much more of a generalist. I don't focus on maternal child health, but I get to see and dabble in all sorts of things.
And where did you get your master's in public health?
I did my master's at the University of Minnesota in the School of Public Health with a maternal child concentration and international as well. I have a love for that work, but
And did you, during your master's, did you travel overseas?
I was always working a second job and doing an internship or 5 and trying to get as much experience as humanly possible. But
And then your first job after your MPH?
I landed in a safety net healthcare system. Some people might know Hennepin County Medical Center, HCMC, up in the Twin Cities. Does really great community-based work, and so I did a lot of work in the home visiting space. We built out a hospice model that CMS was trying out. We built out a behavioral health clinic for Latino teens, which was phenomenal. So got to do community-based side of healthcare and medicine, which is part of the way to public health, but not all the way for me. I wanted to be more in kind of that government public health space. And so eventually ended up down in Kansas City at the Unified Government Public Health Department there, so Kansas City, Kansas side, and ran that health department throughout the pandemic, which was, we all have our own pandemic traumas, but it was an
wow.
interesting,
Yes.
very difficult few years if you were in a health department or especially a health department leadership space. So got through that, and proud of the work that we did in really hard circumstances, but decided if I was going to heal some of my COVID trauma, I should probably come home. And had 2 little kids during COVID too. So came home a couple of years ago and now share a back fence line with my mother because if I'm going to move home, I'm going to move home and get some help. So now I live the dream, and it's phenomenal.
And
to
you
get to do
became the
that.
director of Polk County Public Health about a year ago?
About a year ago, but when I first landed back, I ran most of preventive public health for Iowa HHS.
Oh,
So
okay.
I was,
So you're
the
a
preventive
state
health director,
employee.
running maternal, child health, WIC, all of
Okay.
that stuff for a while, and then, but the local level is where my heart is, and so, what just a great opportune time that position came open.
Okay. And not only are you the director of Polk County Public Health and a mom and busy, but you're in the final process of getting your PhD from Johns Hopkins.
Yes, it's actually a doctorate of public health, but yes, it's for like high-level public health practitioners. So, but yes, we do original research and all
Okay.
of that kind of thing, and it's hard. But I'm
But
just
you
really
do hard
hopeful by
things.
next fall that I will defend and get to move on with my life. But
so a doctor
it's
of
actually
public
been
health,
a
yeah.
phenomenal experience. My focus is public health policy, which drives, I think, a lot of the big change that we need to see. And I've been introduced to phenomenal, not just academics, but people who practice in the field and make policy. So it's
So
been a
I was
great
having a
experience.
conversation today about, the role of policy and the example we use. So my mom and dad each died at age 52 of cigarette smoking. When they were, 20, about 56.9% of adults smoked. Once we made the connection to cigarette smoking and lung cancer, today the national average is more around 15%. Well, that didn't just happen by accident. That happened because the knowledge of cigarette smoking and cancer led to policy action, and it's the policy,
Yep.
not
Yep.
just the information, but the
Yeah.
public policy, raising tobacco taxes, having quit lines, that has led to a change in
Yeah.
behavior and a change
But
in
only
outcome.
with a tremendous effort through public health, right? So that Surgeon General smoking report came out in what, 1968? I want to say 78.
Yes.
Don't
no,
quote
it,
me.
it was in the 60s, because 72 was
68,
then
I
the
think.
NCA.
Yeah.
Yes.
I mean, but even at that point, they embargoed that report until the day of, and press had to come in and could only see the report that day. So it was a huge task of taking some findings that the tobacco industry was trying to hide and translate that into policymaking, right? And they were only able to do that through the data and research that they gained over time. But there were so many decades where that data was there
Right.
and it wasn't shared with the public, and so.
And that little example, kind of for me, so but please share your analogy, but it's sort of what is public health? I mean, just medicine would be, well, let's just keep treating all the people with lung cancer. And public health is, no, let's go upstream and see if we can eliminate the cause of lung
Exactly.
cancer,
Yeah.
not just continuing to expand the treatment of lung cancer.
There's a kind of a model or framework we work in often in public health called the social ecological model. And it has this kind of interpersonal level, and then this personal level and this interpersonal level with others, and then you have your community, the organizations you're a part of, the broader community, and then the policy environment, right? Things that happen at all of those layers cumulatively create the conditions that you're living in and getting sick or well within, right? And so the reason we use that model is because as we're trying to lay out strategies on something like tobacco, we can't only work at one of those levels. We have to work at all of them, right? So I need the organizational model. I need healthcare providers to be strong in my community and to have those resources, right? But I also need employers to understand that they need to give time off to folks so that those folks can go to treatment. And I also need the policy to change around tobacco taxes, significant enough amount that people are going to reduce their consumption. So yes, every layer of that social ecological model we have to be working at, and that's really kind of the public health frame of mind, right? How do we prevent not just somebody who's screening for cancer from progressing worse and worse, but starting at the very beginning, avoiding that tobacco consumption from the start.
And as you said, part of it is personal. You also want to educate individuals too. So it's not just we have.
Sorry. Thank you.
so that we don't just create the public policy without individuals knowing what we're doing. Yeah, right.
And to be community engaged along the way, so the community is working along with you and understands and can receive that education in a way that's helpful for them.
The history of public health, I think of it kind of as we learned sort of germ theory and some of the, especially when you get to the waterborne and sewage and the role that public health was, okay, now we sort of know this cause of illness, and it's something in the domain that government and or communities have a role to play. How when you studied public health, what are you taught as the beginning of what public health is today?
Yeah, I mean, oh gosh, the public health of today, we call it public health 3.0 because we're really in this era where we are trying to focus on policies and systems change. That public health 1.0 was water purification, sanitation, milk pasteurization, immunizations, right? So the biggest public health advancements of the last 150 years, right? So those are kind of really the basics we think of in public health. In our health department, that shows up in the fact that we do.
Go through those four again.
What did I rattle off? Water, sanitation, milk pasteurization, and immunizations. I would add motor vehicle safety improvements, but that really didn't take off until the 60s when Ralph Nader actually made it a huge part of his policy work to
Unsafe
change
at
that.
any speed.
Yes. So that's a great example right there of, people. We can educate people to put on their seatbelts, and that's helpful, and we must. But if it's not a law and something we're have to do, we're never going to win that battle, right? So doing both of those things at the same time is what gets us where we need to be.
And public health, even the word public implies to me that, I don't know if from the start, it is a public-private collaboration. I mean, we're not in a country where the government does everything, and most of health care, I mean, maybe gets paid for much of it but it's private health care. We're not in a country where there's a national health service that takes care of everything. But this public part is this understanding that the government, you worked for this Iowa Department of Health and Human Services, and now the Polk County Health Department. The government spends money and invests in public health. The system of public health through the counties, is that across the country? Does Iowa have a different model for doing public health in other states, or is it similar? And how would you describe the bureaucratic makeup of public health in the state of Iowa?
Yeah, sure. So we are a county-based operation right now. If anybody's paid attention to the behavioral health alignment that's happened over the last 2 years, that appears to be what's in store for us next. So we're paying close attention and quite concerned, to be honest with you, on how that might play out.
So
but
the
we're
mental
unsure.
health, correct, or
behavioral
inform us,
health, yeah.
Behavioral health has gone from county to regions?
Very large, yeah. There's 7 large regions for the state, yeah. But right now, we're with 2/3 or so-ish of the states in the country operate on this county by county region or basis, and then the rest have gone to some sort of regional basis or hubs, or there are a few where the health department just has outposts in different counties kind of throughout. The local model, all the models have their strengths and weaknesses, right? But the local model makes sure that health departments can prioritize the health needs of their local community. And when you dictate a lot at the state level, it makes it hard for you to be able to say, but wait, I'm seeing this trend in my community and I need to put my resources here, right? So it's really important that we keep that local voice and local activity on our boards of health to make sure that we're doing what we need to do.
So I would imagine with Polk County having the diversity of individuals from many, many cultures, there's probably some of our 99 counties that are pretty homogeneous in terms of culture, but Polk County probably is the most diverse of all the 99 counties, and that has to really affect the work that you do.
Yeah, certainly. I will say it doesn't make our work harder or easier than the rural spaces. It just makes it different, right? So we have so many resources that we can access here that my rural counterparts cannot. Many rural health departments have an administrator and a staff or two. We're really lucky. Polk County has invested. We have a staff of about 45. So it can look different kind of in all those different places, right? Where were we going?
I
lost
was
track.
leaning to the role of Polk County Public Health in Polk County.
Oh, just yeah, sure.
Based on the diversity of cultures.
Yeah,
and-
yeah. So, I mean, what shows up, you would imagine, in the cancer space is shows up everywhere in terms of we always start with the data that dictates what our work is going to be, where we're going to focus our priorities. Well, there's a few different spaces. First, we have to start with what's the mandate of local public health that only we can achieve, right? Only we can investigate communicable diseases. There is literally no other entity in the community that can do that or has the powers, right? So that has to be a core function. So we start with what are the things that we have in state and local ordinance that we have to do. But from there, we jump into what are our biggest leading causes of death and of illness, where are we seeing the disparities, which is where we spend a lot of our time, and where do we need to figure out how to resource now. So you can imagine, just as what's shown in the cancer data, our Black community members are experiencing poorer health outcomes across the board on so many different things, unfortunately. Our Latino community members are also faring worse on most, so we're talking cancer, chronic disease, all kind of sorts of health outcomes. So a lot of what a health department needs to do in trying to promote the public health is to really prioritize those high-risk populations that are experiencing inequities at no fault of their own, but because they're living and working and aging in communities that don't maybe have the necessary resources that they need to achieve health on their own, right?
And then develop strategies and policies to help with that.
Exactly.
So the collection of data, so again, I'm a cancer doctor. I know about the Iowa Cancer Registry. Mary Charlton's a friend. I know how that data is collected. I would imagine, but correct me if I'm wrong, that you at Polk County aren't collecting all of the cancer data. You're relying on the Iowa Cancer Registry to provide you with the Polk County data. Would that be correct?
To some extent, we also do have our own data sources. So, for example, local health departments get all the vital statistics data. So I do have access, about a year later, to all of the death records that happened that year, right? So then I can see the ICD
Okay.
codes of what's on that death certificate, and I can see the cancers, and I can see that outlay and that geographic distribution. So we absolutely rely on experts like those folks to do a lot of that analysis, but we have birth and death records, we have emergency department visits, we have other data sources that we can go to create our own analyses as well, and that's what's often fueling our decision making.
When you look at chronic disease and then which populations have it, do you collect that data? Or, so for example, for cancer, every year the Iowa Cancer Registry provides your county with the cancer data, or do you independently collect that as well?
Not from healthcare providers,
Okay.
no,
Gotcha.
because they're already
And then what
doing
about
that.
the other diseases, like deaths due to heart disease or deaths due to lung
So we get all that
disease?
death data, but we don't always get the incidence data, although that's something that we are actually working with all three of our healthcare systems now and have gotten access to EMRs and are working on more data sharing. So I'm excited about where we can go on this kind of a thing. Yeah.
And then how is your department divided up in terms of the work that gets done?
Sure. So we have a clinical team. So if you come into the front of our health department, you're going to come into a clinic. We have a environmental health team that mostly does lead remediation. We're getting more into radon because we really need to be in that space. We have our cancer prevention and screening team who do phenomenal work largely around getting folks who can't afford it access to testing and screening and the first round of diagnostics that they need before they enter any sort of care, which is a huge piece of our work.
Who can come to your clinic? So you have a clinic? Do people just walk in? or-
Anybody can come. We primarily serve uninsured, underinsured Medicaid folks.
Okay.
So we no longer accept private insurance. We prioritize folks without insurance. We actually lose money and end up subsidizing care because we can't get the private insurers to pay us enough for things like travel vaccines and things. So we primarily serve those underinsured, uninsured, but we can serve other folks if they're willing to pay out of pocket and then reimburse reimbursed through their insurer later.
And you mentioned travel vaccines. So I am aware that, if you're going to a foreign country that requires certain vaccines, that people can come to you. Can people come to you and pay out of pocket?
Yes, that's what's most common.
Okay.
It's a service that's used really frequently because many providers in the community don't stock those travel vaccines because they are very, very, very expensive, like in the $600 a shot kind of stuff. So we do stock pretty much for anywhere you could imagine going. So people come to us a lot for that because their provider can't quite get them what they need. And they do have to pay out of pocket, but again, they get that receipt so they can go back to their insurer and get reimbursed whatever that insurer would have covered. But again, I can't subsidize that for folks who do have insurance, and so we're really prioritizing those other folks.
Okay. And then you mentioned communicable diseases. I think most of us who have any concept of public health realize that that's part of the role you play. What are the communicable diseases that Polk County Health are dealing with? Which ones are mandated to be reported, and then which ones are, are you trying to trace to that first contact tracing?
Yeah.
Is that still something
Yeah.
that is done?
Oh, that's still something that we do oodles of day in
okay.
and day out because
Think of, Typhoid Mary or case number 1.
unfortunately, TB is very alive and well, and not just latent TB. We have a really high caseload of active TB right now. Across all sorts of different populations. I would make no assumption about who these folks are. They're from all different walks of life. Kiddos, adults, quite a few folks. So that's something that takes a tremendous amount of time and effort because you have to directly observe folks taking their TB medications, often for months. And sometimes, when we get drug-resistant TB, people are on meds for a year, 18 months kind of thing. So that's really intensive for our team. We, of course, also do all of the STI, HIV stuff, so we're managing an incredible amount of syphilis right now. Unfortunately, we've lost an infant or a newborn recently to congenital syphilis. So this is real. We're beyond just, young people having sex and we've, got to work on STIs. Like we're really in a rough spot there. We actually just lost a grant from the state for 2 of our STI investigators the other day. So that's an area where there's just not investment in right now, STIs and kind of that reproductive health stuff from what we're getting for funding, unfortunately. But we still have the team who does all the, we're the ones who notify folks who are positive for HIV often. So we do a lot of counseling and sitting down with folks, a lot of getting partners access to treatment quickly and easily to make sure that we're catching kind of all of that. But then, we also do stomach flu, or not stomach, GI-related outbreaks, those sorts of things for communicable disease, all the respiratory stuff. We've only had 1 measles case, but if any more come, that's all on us.
Yeah,
so we're all prepared for that.
So tell us about measles. What is the role of the Polk County Public Health in measles?
Sure, yeah. So we're kind of the behind the scenes that's really trying to coordinate across healthcare providers and that patient and whoever else is involved in that particular case, right? So oftentimes we become aware of a test coming through, we step into action immediately to interview that person as quickly as we can to know where they've been, the 4 or 5 days prior when they've been in their infectious period, backtracking all of that. Then we start making those calls to the places they've been, the people they've been in contact with, and the web grows, as you can imagine. So eventually you're talking to a lot of people, and anybody that they've been who has been exposed to them while they've been in an infectious period then also themselves have to go into a period where we monitor them. So we have to monitor and check in with them every few days for symptoms. And so it's a big web game of trying to get in front of as many people as you can, as quickly as you can, and getting them to follow your advice and adhere to your recommendations in a time when they're often scared and worried and are unsure and maybe will lose their job if they don't go into work the next day, right? So of course we manage a lot of the clinical stuff, but a lot of what we manage is social needs and support so that people are able to comply with quarantine and isolation, because you can't if you can't pay your phone bill because your boss has told you one more shift miss and you're out, right? So we deal with a lot of that real world, real life stuff that people are having to go through when they're in times of a health crisis.
Let's talk about cancer.
Please.
Describe for us the role that Polk County Health plays in terms of cancer. And obviously, I'm talking about the entire continuum from preventing cancer to early detection and screening to treatment and then beyond.
Sure, yeah. Full honest answer is the health department's trying to figure out what exactly the right role for us is, right? And this is something we're doing all the time on all sorts of different topics. And we're doing that by constantly weighing where the need is and who's already doing work that we don't need to do, right? So in this space, we've been for a long time in the screening and testing space with our breast and cervical cancer screening testing, which has gone well and which we're very proud of. I would like to see us expand substantially. I think it's less of our role to get into the formal medical care provision space because we're not needed for that. There's experts doing that. We are very lucky in Polk County to have some great systems who can manage that. But we are not, in my opinion, strong enough in that primary prevention space around radon, tobacco use, obesity. If you want to proactively prevent as many cancers as possible, obesity is your number one, right? Smoking too, but it's the highest risk factor that's best documented for the greatest number of cancers and one of those things that people could do immediately. Now I say that like it's easy, it's not, right? But there's things we could be doing in the chronic disease risk reduction space around obesity prevention, nutrition, physical activity, all of that stuff that's not very fun and sexy, to be honest with you, but that's really the core bones of how we create healthy humans. So challenging.
When you get into, what are you eating?
Yeah.
Back to tobacco, are you involved in tobacco control, and how would you define that involvement? So, for example, are you involved in smoking cessation? Are you involved in advocacy around, I don't think we have a Polk County tax on cigarettes.
No, we don't.
But
I would like
But
to.
there's bills that are being debated right now
There
at
are,
the State
in the state,
House.
yep.
What role can you, as a public health expert, lend testimony to that? I know sometimes if you're a government employee, you're limited as to what you can say and how much you can advocate for a bill. But back to tobacco, what would you say the Polk County Health Department's role is on tobacco and tobacco cessation?
Sure. I would love to run a cessation program. That's a goal of ours. We're not there yet. Right now, a lot of what we're doing is data analysis and informing partners. So, for example, on the current tobacco tax, I believe there's a bill on either side.
There's two bills there may be more, but I know that there's a bill that would increase it by $1.50 a pack, and then there's a bill that would increase it by 65 cents a pack.
Yeah. So we've been working with other partners behind the scenes to really help tell that story, that if you don't increase that price enough, it's not going to give you what you want. It's not going to give you the outcome, the decrease,
It's
all
not
of that. So ours is
linear
more.
if you
We do a lot of talking about our tobacco use data, right? So nationally, tobacco use rate's 14%. At the state, it's 16%. In Polk County, it's 18%. So we're sitting 4 points higher. We don't need to be. We also are doing a lot of talking about how we've lost data and line of sight into kids vaping and tobacco smoking because they did away with the Iowa Youth Survey, unfortunately. So we no longer have any data to know. I think 4-year-old data is what we're working off now, trends and stuff around kiddos and that. So a lot of it's that kind of stuff. But my hope is, and I assume we're kind of getting there eventually, is that by launching this Polk County Cancer Coalition that we're going to be bringing online in May, we can get a group of partners to focus more tightly with us on that upstream prevention space and be more active, but do it in partnership with some others in more of a concerted multi-strategy way, again, within that social ecological model to make sure that we're doing something that isn't throwing drops into the wind, but becoming concentrated enough that it can change something.
So we talked about tobacco. We've mentioned radon. what role does Polk County Health Department play in terms of radon awareness,
Yeah.
radon testing, and or radon mitigation?
Yeah, that's another question we're asking ourselves. We have put aside money, and we're hopeful next year to be doing kind of a big radon campaign. I will tell you, I'm really interested in those super high lung cancer rates among smokers in high radon homes, where it's just really an exponential risk. And I think there's a lot of targeting and messaging we do there. I'm also interested in helping trying to reduce the stigma with tobacco use. At this point, for many people, there's more stigma related to tobacco consumption than opioid use. And one's not better, worse, I'm not judging. But the fact that the vast majority of lung cancer cases in Polk County are caught in very late stage is a problem for us. It means we need to be talking about testing and risk factors, but doing it in a way where there's not so much stigma that smokers feel shame and don't
Right,
come forward
right.
and get tested and
Because,
treated. And that's a
yes.
cycle we're seeing.
There is a screening test for smokers for lung cancer. If you find lung cancer at stage 1, it's 90% curable. If you find it at stage 4, it's about less than 10%. Stage 3 is probably down to 30%. So finding it early, but it is the screening test that is least used. I mean, 80% of women are eligible for mammograms get them. About 15% of people eligible for lung cancer get them. And you're right, the stigma and shame, because the only way you get, any woman can get a mammogram. You're a woman, you're eligible, but you're only eligible to get lung cancer screening
Until you
if you say you're a smoker and you smoke a lot and you've been smoking for a long time. So if you, because of shame and stigma, don't say that, then you don't get flagged as being eligible for screening.
And even memory and recall, right? Like, I could have been smoking really heavily 15 years ago, but in my mind, that actually wasn't very heavy smoke. You know what I mean? Like, things change over time. And so, yes, having to have that positive screen, it's a challenge for folks. And I think, again, something like a Polk County Cancer Coalition can do a small thing like raising awareness of that screening tool. Like, how do we get providers together and start to jumpstart that?
And you did talk about breast and cervical cancer. So I know that there is a national program that is funded in part, I think, by the CDC. That's the breast and cervix cancer early detection and treatment program. Do you administer that program at the county level?
Yes.
Does it come to you from
Comes
Iowa
to us from
Department
Iowa Health and Human Services, yes. And we do it at the county level, although we actually have several other counties who we serve as well, which is not uncommon for our health department. We have catchment areas of broader counties just because of our robust size. But we get basically a little bit of funding for staff time, not much. But basically, it's funding that we get per screen, per test, where they're just covering those costs directly. So patients don't have to cover them themselves, which is really a huge blessing, because a lot of times that delayed diagnosis is sometimes not because they didn't want to, but they know they don't have health insurance and they don't know where to go. So you kind of stay quiet about it, right? So
Yes. And so one issue that is always difficult, because you don't know exactly how to talk about it, what terms to use, and whether you can talk about it. It's individuals that are do not have legal status. I don't know, is that the best way to describe it? And are those individuals eligible for the programs that are run by the state and or the county? And are there some programs that they are eligible for and some programs they're not eligible for? And how do you
Correct.
approach even talking about it? And what's the terminology you use when you're interviewing people that walk in the front door?
Yeah, we often talk about our folks who are undocumented or have non-citizenship status. This is a big one for us, and we try really hard to kind of stay up to date on it, because things are kind of constantly changing around who has access to what. The upcoming October Medicaid cliff for our refugee folks that's coming up is going to put a whole bunch of people off. So it's
They're going to have to go off of Medicaid
Yes.
and be left with no insurance.
Yes, yeah, a number of our refugee community, if they don't have their green card paperwork submitted and approved. How different states and municipalities are going to read that law change remains to be seen, right? But all that to say, yes, some things we can offer to anyone. The vast majority of our stuff we still can.
Okay. That's good.
we just are bound by the folks who fund us, right? And so, for example, they're discussing right now removing WIC access for folks who are undocumented. Those are the kinds of things that are likely to come online that we're trying to pay attention to.
WIC is Women, Infant, and Children, and that is what we sometimes refer to as food stamps, or no?
It's a different program.
Different
It's
program.
supplemental nutrition specifically for women
women.
who are pregnant or raising a kiddo up
Gotcha.
to age 5.
Gotcha. And it does stand for Women, Infant, and Children.
Yes.
That's the WIC.
Yes.
But that is a separate program.
Yes.
And so up until.
Well, right now in Iowa,
You can still provide
undocumented
that.
folks are still able to access it, but there's a bill that made it through second funnel that would remove their access, which would be catastrophic for some of these moms with multiple young kiddos and pregnant, especially in the era of ICE raids and just the general fear that's happening.
Okay. What other role does the Polk County Health Department play in cancer control?
Yeah, so I think, honestly, besides data, our biggest role in a lot of different spaces, and I think similar to this one, is to be a convener and facilitator across community partners, right? I mean, I think you're one of the masters of partnerships. You've figured out how to kind of build that across the community, which is phenomenal. But I think outside of just cancer care, there's broader community stakeholders that need to work together on some shared common strategies, right? Like that primary prevention. So on May 7th, actually, we're going to be launching just a really Polk County specific cancer coalition that is going to be focused on taking the Iowa Cancer Plan created by the Iowa Cancer Registry, which is a great plan, well-researched.
Yeah, the Iowa Cancer Coalition.
I'm sorry. Yeah. Yes.
Yes. I'm vice president of the Iowa
Oh,
Cancer
thank you.
Coalition. So, yes, we are the organization tasked with
Yes.
having the Iowa Cancer
That's why
Plan.
we have you here.
Yes.
Bless you. So that plan is great. Our question now for Polk County is, given our data specifically, which, for example, has lung cancer at a higher rate than the state necessarily, what should we be prioritizing today? So based on our data, based on the gaps we have, and based on the resources and assets we have too. And so our hope is to bring together a diverse group of stakeholders and get into 3 working groups on the 3 pillars of your plan, which is that primary prevention, that testing and screening, and that treatment, and hopefully incorporating some of that survivorship stuff
Survivorship
too
too,
as
yeah.
well. And so, yeah, we're going to start diving in with partners who some have done this for a long time, but we've also heard from a lot of folks who have a passion, want to work in this space, or their organization only touches it tangentially, and now they really want to get active and involved. And so we're really excited in partnership with Des Moines University, who's going to help be our kind of data steward through this and constantly evolving, help us with that. We'll go through a period of about 6 months of planning on around these 3 areas of the cancer spectrum. What strategies from the Iowa Cancer Plan are we going to take on here over the next 3 to 5 years? So herding the cats a little bit is often the role of a health department, because people are doing amazing work and sometimes really well in sync with each other and sometimes a little unaware of each other. And so we can be folks who can bring that together and then create an actual Polk County plan so that we have something we've committed to and can put online and track and have kind of quarterly progress updates on it and be held accountable to, because folks deserve that.
Today, we had a press conference at 1 o'clock at the Harkin Institute, the release of a major white paper that was a year of research on the role of environmental risk factors and cancer in Iowa. And part of it was on water, and in particular nitrates in water. And then part was on herbicides, pesticides, part on PFAS, and part on radon. My question is related to water. What is the role of Polk County Health in terms of monitoring water, not for infectious disease, but for things like nitrate? Is that a role that you leave to Waterworks, which is not a Polk County entity, but it's kind of a
Correct.
hybrid, or the state, or do you have a role in monitoring, for example, nitrates in water?
Sure. So we don't do direct monitoring, but we work across sources to do a collection of monitoring, right? So we're pulling from Des Moines Water Works, for example, from the nitrate data, which they put out on their website every single day. They're good at putting their data out there, right? Like it or not. But we're also working with our public works and our conservation departments to look at monitoring they do related to water that's happening in the streams and in the lakes, and even looking at things like mosquito presence around certain bodies, but so all sorts of kind of stuff related to that. We're bringing that information in, and actually right now we're about to launch in 6 or 8 weeks a really large Know Your Water, Know Your Health campaign that's been funded by the Health Department, Public Works, Conservation, and the Board of Supervisors. That's going to be built out over many, many modules, but trying to answer so many of the questions people have related to their water and their health. Everything from, is my tap water safe, to can I shower my dog in the backyard and let that water run up? Like, the amount of questions we get are wild and varied, but they're real and people need answers to them. And so we're working really hard with scientists right now to build out an education campaign for folks around what can they do at home in their personal use, community use, and business use, and then recreational use, how you keep yourself safe physically, but mostly, consumption-wise.
Can I swim in Gray's Lake? Those sorts of questions. I'm just amazed at the breadth and depth of what your mandate is, and I wonder a couple of questions. One, I don't know how you can do all of that. You must work 23 hours a day, but secondly, I wonder, of all the things on your plate and all the things that fall under your purview, what are the health issues that keep you awake at night when you're trying to get your 2 hours of sleep?
My brain is scary in the nighttime. No.
What are the things that really keep you awake, that you worry most about?
I worry about my 4-year-old being backed over by a large Suburban in their blind spot. May be honest with you. I used to oversee the child death review team. These things are real. So those small things that you get to see up close, like, just penetrate. My kids are 4 and 6, right? So the vast majority of what I'm hyper worried about. You're most likely to die as a young person in Polk County by being shot by a gun. So I'm worried about my kids being in a school, a daycare, someone else's home, anywhere where there's a firearm. The vast majority of firearm deaths are from a gun that's borrowed from someone that someone knows, including our kiddos. The vast majority of kiddos who end up in a firearm death, it's come from a parent or someone around them who they know, right? Those are the things I worry about, because those are unnecessary risks, right, for our kids. I do worry about environmental exposure. Radon is real, nitrates are real, right? And so as a mom, I'm constantly kind of figuring out, what can I do that's in my power? Besides, the reverse osmosis system that we're working on and those sorts of things, and harping at them constantly.
Seat belts and the child seats and.
But a lot of what we do, and I often describe, and maybe I should have led this way, I often talk about how public health is ultimately, at the end of the day, it's a team sport, and it's an activity that you do together, right? Public health isn't this stagnant thing. We are doing public health when we're communicating about, researching about, implementing a program, whatever it is, right? And so I feel like there's endless opportunity, and the worst thing we can do is try to fix all of it. And so we're trying really hard with our department to follow the data, pay attention to our partners, let them do their work, and us fill in just the gaps where we need to be. Yep. And then again, I'm always going to be prioritizing the policy solution, because it just has the ability to affect a greater number of folks. And so I need my physicians and my care teams to focus on individuals and, healthcare system policy and treatment and diagnosis. And I need to be working on figuring out, how do we make sure those folks are discharged into healthy communities and systems where there's the essentials that they need, right? That's how we work together and create a community.
None of us is as good as all of us.
Oh, gosh, no.
So 2 questions, but you might have already answered them, and then we're going to go to Q&A with our audience. So the 2 questions are, number 1, what have you accomplished since you became the director of Polk County Health Department that you're most proud of? And second, what are you most excited about in terms of something that you're going to launch within the next, sometime later this year?
Oh, those are good questions. I think I'm probably, one of the things I'm most proud of is the changes we've made to our data. It sounds really boring, but we have not had a strong surveillance system. And so, like, something amazing that literally just happened either Monday or late last week, we signed an agreement with Des Moines Public Schools so that we get to automatically have their absentee data, so we can be monitoring in real time every morning where are we below 10% absences, how do we give guidance to school nurses, how do we help principals know when they've got a real situation, right? And so there have been 4 or 5 big data systems we've been able to get access to and work with partners to build their trust and help them understand why public health needs this data. We are incredibly stringent and work so tightly on our data controls. But we're working in a way to make sure that we have real-time data so that, especially in communicable disease season in the winter, but all years round, as anything is kind of coming up, a new trend, we can spot that as quickly as possible and we can get that information out. So I feel confident that we're in a better place to do that today than we were a year ago. Also having access to our hospital centers and them working and sharing data with us. And so as non-exciting as it is, that is the bread and butter of public health. If we can't show it with the data, we can't really do much with it. So that's something I'm really proud of. I am really excited, honestly, to launch a couple of campaigns that we have coming up. We talked about the water and health campaign. We'll also be launching with the MPO and traffic engineers and folks all across central Iowa, a really large traffic safety campaign coming up that I'm really excited about. Traffic safety is still something where we're losing people unnecessarily all the time. The rise right now is deaths of pedestrians, bikers, walkers over the last few years. Our traffic fatality rate has doubled in the last 7 or 8 years here in Polk County alone. So we've really got some work to do. And again, it's one of those things where we're working with City of Des Moines engineers to modify the built environment. We're working with, educators on talking to students. We're pushing out PSA campaigns. We're working on safe routes to school. So how do we layer all of the approaches to work on something that really needs some attention? So that's another one where we've got kids participating and creating content. We've got a lot of energy and activity, and it's one where I hope over the summer we can get a lot of folks paying more attention because it's something that's very real, and we just lose a lot of folks to traffic fatalities, unfortunately.
Well, great. Good answers. We're going to open up to questions.
Please.
So we have a large in-person studio audience here. You guys get first questions. If you're watching us online, you get to ask questions as well. Please put your question in the chat box or the comments section, and we will read your questions. But we'll start off. Gary, you get first question.
Yeah, when you were going through, the list of, things that are, cause cancer and stuff like that, there's one that I know that our governor is concerned about, and that is alcohol. And what's your role in that, and what is happening with it?
Yeah, absolutely. I would put that for us in the same realm with tobacco, where we're not doing quite enough to kind of educate folks. It's really clear that any amount of alcohol is harmful to your health at this point. And so my hope is that, as we were talking about that primary prevention work group coming together, that this would be a piece that they take on as well. And it may be a campaign where we work on tobacco and alcohol kind of similarly or in tandem. So I know that's kind of been pointed to as, the be-all end-all of cancer for some folks in Iowa, and that certainly isn't it, but it is one factor that does increase risk for a number of cancers, and absolutely we should be paying attention to it.
Great. Next question.
Yeah,
Yes,
you
Kevin.
said that Iowa has a county-based public health system. Are there 99 county public health departments in the state?
I think there's 96. There's a couple of part of small counties that came together with their 2 staff and made like a 2-county health department.
Sounds crazy.
They're starting to. There's 2 other, actually 3 county areas I've heard of that's working right now and trying to figure out how you do that. Yeah. So I think I am a fan of that. I think we do need to work on bringing some of that together as long as locals can help define that, right? And not just chop up a map, but say, okay, these counties naturally work together, or these counties naturally share a population. Let's get them. Yeah, it's the only way forward, just simply because of the reality of population change and demographic movement. It's going to have to happen. It's just what will it look like and how soon and who gets to make the rules.
Ron?
It sounds like you've got an incredibly difficult job.
Appreciate you saying that. It's been a hard day.
But, and it seems like there's been a lot of outside pressure on shaping public health policies. Are you feeling that, and how do you deal with that or mitigate it, or is there a chance?
And maybe a pointed version of that question. Can you advocate for immunizations?
Yes, I can. I'm really grateful to say it's. I appreciate that acknowledgement. Like, I sincerely do. It's a difficult job. I feel pressure from the moment I wake up to the morning I go to bed, right? As many of us do in kind of high stakes positions. And I overthink and overwrite my talking points for every interview and everything that's given, right? But I also made a deal with myself when I started that I was not going to enter into a role where I wouldn't say the thing that needed to be said. Now, I might finesse it, and I'm going to use different language with different people, but I'm never going to stop saying that we have to immunize our kids and we have to stick to the schedule that we know works, right? And yeah, there's a lot of reasons that we have cancer, but nitrate is in there too, and we're going to talk about that. And so I feel blessed. I've gained the trust and support of my leadership team in the health department, and we know what our job is. Our job is to speak to the truth and to the data. And we're going to be stopped from doing some things, and we're trying to be better at figuring out which hills to die on and which ones to not, because when you die on every hill, that's when you really become just psychologically drained and, you really struggle. I will say I have a supportive boss in the county administrator, and I can't tell you how grateful I am for that. I have an elected body that's also my boss, and that's just always going to be tricky, right? You've got folks from different spaces on the continuum, and that's all okay. It truly is. I can manage and walk through that every day of the week as long as I can be true to saying what I know I need to say and not hiding the thing that needs to be said. And so there are days I wonder how long I'll have a job. And it's the nature of the thing. But I also want people in public health to know that this is our job. Our job is politics, and there's people in public health who still think politics has to stay out. It's just not reality, right? Because we know the science of immunizations, and whatever the politics say, that science is the same. So,
Do you have to report officially, like in person, to the Polk County supervisors once a year or twice a year, or only they ask you to come in when there's a problem going on?
So the Polk County Board of Supervisors is the formal Board of Health. It's weird, but they put each forward a member and create a Board of Health Advisory Committee that I report out to each month. Okay. But that's fairly inconsequential. It's a helpful group of folks, but it's really my elected folks. And often it's working with them before we put things out. We don't surprise them. They all know the Water and Health campaign is coming. They've all gotten to see the outlines and the bullets, and we sit in front of them and ask, what are you most concerned about, right? So the other thing I think is not being too afraid to talk to people, and I try not to assume anymore where they're going to land on something, because a lot of them have surprised me. And so I try to keep an open mind too, that I might assume by party affiliation they believe this thing. They also may have had a daughter who had a miscarriage and they really care about this thing over here, right? So many things can be true at once. But to answer your question, I exercise religiously, and I block every night, aside from this one, from 5 to 7 with my children, and we play outside. But we'll make up time this weekend.
Thank you for Tim.
Yeah, so one of the buzzwords of today's era is AI, artificial intelligence. Do you see that coming into your arena, in the political arena? Do you use it today? Do you log on to ChatGPT or Claude, or use any other of those large language modules?
Yes, I hope and encourage the public health field to adopt as quickly as we can. We are under-resourced, understaffed. Across the nation, public health infrastructure dollars are around 20% lower than they were pre-pandemic, so we didn't come out stronger. We came off much worse, actually. And we don't have a choice but to use AI. So I'm trying really hard to coach my leaders and people I work with on how to use AI appropriately. If you feed AI garbage, it will give you garbage. But if you are disciplined, know how to master your AI, know how to give it prompts, know how to force it to reassess what it gives you itself, learn how to share with it your biases, there are ways you can train it to be incredibly smart and incredibly helpful. And I use it to draft memos all the time. Now, am I going to sit down as an expert and go line by line myself and make sure everything's perfect? Yeah. But it can take. One of the big things we have to do in public health is synthesize all this information down into what's the talking point. It's a hard thing to do. Or take all this and share what's the 3 data points. You can feed it stuff where it can narrow it all down for you to give you a place to start with and finish something so much more quickly. So we're just starting to look into what are the data capabilities. That's different because I would never feed it, for example, like a death certificate data set. I'm not going to put people's data into something like that. But how do we use it to think about how we can train ourselves to do data? How can we use it when possible with totally de-identified just numerical data? But a lot, my staff has to write a lot and do a lot of analytical work, and we just have to use AI in a really smart way and put in human checks and controls to make sure that we're not making silly mistakes. It's kind of my approach. It's not everybody's, but because we just don't have the man and woman power we need, I think we have to see it as a resource rather than something we're not interested in dealing with.
One last question. Poon, you
Sorry.
got the microphone.
Can families bring their kiddos into Polk County Health to get their vaccines that they can't get at their doctor's office?
I hope they will. Yes, absolutely. So we actually work really, really closely with our school nurses, and usually when someone's behind, they'll call us directly. We'll schedule that kiddo together. We know when they're coming in, and so we welcome kids, insurance or not. We're going to help kiddos get vaccinated. Again, insurance or not, we hope folks will come in and ask us the questions that they need. Check out our website. It's getting much further built out.
And your website is?
Of course you're going to do that to me. My PIO Addie is going to be so angry at me.
Okay.
PolkCountyIowa.gov/health.
You could just put in the search engine.
I think it's
Polk County.
PolkCountyIowa.gov/health.
Okay. Polk
But yes,
County.
Polk County Health Department, although there are many Polk County Health Departments, so Iowa,
Oh, yeah, Iowa, yes. There you go.
not
Well,
Florida.
thank you so much. Our guest this evening has been Julianne Van Loo, Director of Polk County Health Department. Thank you so much for taking time away from your 2 kiddos to be
Oh,
with
hush,
us.
no, they're just fine. Thanks for listening to me ramble. But anytime people are interested in public health, we genuinely appreciate it because it's a team sport and we need everybody to be together as much as we can. So.
Great. If you're watching us this evening and you know someone that would benefit by watching this program, you're in luck. It will be available on demand at the Above and Beyond Cancer YouTube channel and also the Mercy Cancer Center website. I hope you'll join us again next week. Thanks, everyone.
Thank you.
Thank you.